Hello again, this is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today what I want to talk about is PMS, premenstrual syndrome. I know it may sound a little weird that a chiropractor is talking about PMS, but what you may not know is that your central nervous system, which is composed of the brain and the brainstem and the spinal cord, basically is the seat of control for everything in your body. Not just whether your muscles are tight, not whether you have pain, but your hormone system, heart function, respiratory function, and all the other functions that exist in the body. So I've often said what makes one woman during that time of the month be very difficult to be around, be curled up in bed for 2 days taking Motrin and not feel well, and what makes another woman go through her cycle and people around her don't even know. There's got to be a difference between those two individuals, and the difference is it's normal. There's a normal ebb and flow of hormones as a woman goes through the monthly cycle, but if someone is functioning well, they're functioning at their optimum, the cycle may be like this, and another person who's had 3 whiplash injuries and they took a soccer ball to the head when they were 13 and they caught a back edge on a snowboard when they were 25, and all of a sudden they have a big misalignment here at the base of the skull, which is irritating the spinal cord. It's interfering with the central nervous system. It's interfering with normal function. Instead of the ebb and flow of the hormones being like this, it's like this. And so as a consequence, they're irritable, they got terrible menstrual cramps, and it really just comes back down to function. So it doesn't matter whether someone has migraine headache, they have low energy, they have PMS, they have severe menopausal symptoms, they have low energy, they have lupus, fibromyalgia. At the end of the day, there's only one disease, and that's that the body's not working right. And so in our office, the Upper Cervical Healthcare office, what we do is we specialize in determining whether there is a vertebra in the upper neck area that's misaligned, that's irritating the central nervous system, and is decreasing the body's ability to function properly. Now, getting this corrected is not the cure-all for everything. It's not the cause of everything. But if the upper neck isn't how it should be, again, the body's not going to work the way it's supposed to, and that can cause the body to malfunction and create a whole host of different problems that people suffer from. So in our office, we take very precise x-rays that look at how this joint and this joint fit to the two joints on the bottom of the head, and prior to taking the x-rays, we run a battery of tests to determine whether that upper neck vertebra is locked and is irritating the cord or not, and the x-ray tells us what direction. Is it back into the right? Is it back into the left? Is it up and forward to the left? And once we have that information, then there's a precise correction with no twisting, popping, or pulling made to reposition that segment that's irritating the spinal cord. So over time of keeping it there, structurally the soft tissue and muscles that have been patterned in that bad position will heal, mend, and repair. And most importantly, this brainstem here and the central nervous system will start to recover and function more normally. Now the consequence of that is that when the body works better, quite often hormones can come back into balance, pain is reduced, structure straightens, and when people feel better, they're less irritable. And oftentimes we've had women come in with bad PMS symptoms, and by correcting the upper cervical spine, allowing them over time to return back to normal function, many of those types of problems will fall by the wayside. So if you've come across this video here in the Los Angeles area, we have 2 offices. One's in Wilshire and Normandy in Koreatown. And we offer a free consultation exam if you'd like to take us up on that. The phone number in the LA office is 213-399-7772. And our Carson office is in the Torrance area, the 110 and the 405 freeway. That office number is 310-324-6172. If you're outside the Los Angeles area, you've come across this video, it's piqued your interest, and you want to find someone in your local area, give our office a call. We'll be happy to find you someone in your locale. Hope this information was valuable and it will reach the people who need natural health care, correcting causes, not treating symptoms with drugs. Have a good one.